Welcome back to the Wall Street Podcast.
Glad to be here.
Today we're taking a deep dive into a recent Goldman Sachs research report. It's titled China Healthcare Services, Drug Chains, 1H25 Recap, Traffic Shifting to Online Given Stricter Policies, Slow but Ongoing Consolidation.
Published September 4, 2025, it's a look at China's retail pharmacies in the first half of this year.
Right. We'll be looking at the pressures on the physical stores, the move to online channels, and how the industry is reshaping through consolidation.
And extracting the key takeaways for you. Let's start with the offline market.
Okay, so Manet data shows the offline pharmacy market actually contracted, dropped 2.2% year over year in the first half of 25.
And a big part of that seems to be tightening national healthcare insurance, the NHI budgets.
Yeah, and stricter reimbursement policies, too. They seem to be actively pushing traffic towards online platforms.
There were reports of numerous spot checks in the second quarter. Some pharmacies in Shanghai, for instance, had trouble processing reimbursement claims,
which led to lower NHI revenue exposure for quite a few players. Dashenlin share, for example, dipped slightly from 32% in 2024 down to 30% in 1H25.
So they're adapting, diversifying away from just relying on those government reimbursements because the policies are getting tighter.
Makes sense. But while offline struggled, online, specifically telemedicine, saw strong growth.
That's right. Both O2O, online to offline pickup, and B2C direct delivery models did well.
Platforms like JD Health actually grew revenue in categories where offline was declining.
And non-drug products already have high online penetration. Think medical devices, nutrition supplements.
Right, those aren't usually reimbursed anyway.
Exactly. B2C pharmacies already held like 45% and 58% market share, respectively, for those back in 2024. It's quite high.
So despite, over 30,000 store closures industry-wide in the first half?
Which is a huge number.
The big players that Goldman Sachs rates as buy as Yifeng, Dashenlin, LBX, they reported relatively stable revenue. Flat to slightly positive, actually.
Yeah, between minus 1.5% and plus 1.3%. And they increased their total store counts.
Clear signal of consolidation, then. The big are getting bigger.
Definitely. And looking forward to the second half of 25.
Well, companies seem to expect a gradual recovery. They think the pace of store closures might slow down.
And Dashenlin even mentioned plans to potentially resume acquisitions.
Which points to more consolidation, doesn't it?
It does. And these leading offline players, Yifeng and LBX included, they aren't just sitting back. They've significantly built up their online presence.
Right. The report says telemedicine revenue was around 12–13% of their total revenue in 1H25. That's substantial.
And monthly data suggests some market stabilization since May. Same-store sales growth is holding positive.
But it's not uniform across products, is it?
No, quite divergent. Essential things like human albumin injections, insulin robust growth there.
But discretionary items. Premium traditional Chinese medicine, healthcare supplements.
Those saw declines, likely hit by general consumption weakness.
Okay, let's dig into some specifics. First question. How exactly do these stricter NHI policies impact the market and, consumer behavior?
Well, directly, they're a key reason for that 2.2% offline market dip we mentioned.
Okay.
When you, as a patient, face hurdles getting reimbursed in a physical store, maybe the process is stricter, maybe there are spot checks.
So looked elsewhere.
Exactly. You increasingly shift purchases, particularly for things you don't need immediately, to online B2C channels where maybe it's just simpler. Even if not reimbursed, it changes how people access things.
Got it. Second question. Why the big gap in online penetration between drugs and non-drugs? You touched on this.
Right. It really boils down to two things: reimbursement and urgency.
Okay.
Non-drug items like devices or supplements usually aren't covered by NHI anyway, so there's no barrier to buying them online. Hence the high penetration, 45–58%. They were naturals for e-commerce early on.
But drugs?
Drugs are different. Historically, people relied on offline pharmacies for urgent needs, plus they benefited from the established NHI reimbursement in physical stores.
So the online shift is slower for drugs?
Slower, yes. Still growing, but more single-digit growth as consumers slowly adapt their habits, especially for chronic medication refills, perhaps.
Okay, final question on this. This ongoing consolidation. What does it mean long-term for the competitive landscape?
I mean, connecting the dots, it signals a maturing market. The stronger, better-managed chains, Yifeng, Dashenlin, LBX, are actively expanding.
Through M&A and opening new stores.
Exactly. And they're doing this partly because smaller, maybe less efficient, independent pharmacies are closing down. The report suggests about 5% are closing annually.
So Fewer players, but bigger ones.
Precisely. It reshapes the whole competitive field towards a more concentrated market.
So bringing this back to the general public, for you listening, this whole shift means adapting how you get healthcare products.
Those stricter reimbursement rules at your local pharmacy, they might nudge you to check online options more often, especially for certain meds or devices.
Which impacts convenience, obviously, but maybe also cost, particularly for things not covered by insurance. It's sort of a new reality for managing health purchases.
And the data suggests the market is finding a new equilibrium, stabilizing amid these major shifts.
So the crucial question left for you is, as these offline giants make a more aggressive push into online, and consolidation continues to reshape everything.
Which business models are really best positioned to win in the future of healthcare retail? And maybe more importantly, what does all this mean for innovation and your choices as a consumer down the line?